A quick note before we begin. In this video, I use terms like self-inflicted hanging and non-judicial hanging. These are standard phrases used in forensic science to describe what happened to the body, not to make assumptions about intent or judgment. I use this language to keep the discussion focused on skeletal anatomy and evidence, and to talk about a difficult subject as clearly and as respectfully as possible. You've seen it in movies. A detective steps into a dimly lit room, glances at the skeleton, and says something like, "Looks like a hanging. See the neck?" A line or two of dialogue, a nod toward the bones, and the mystery seems solved. But real forensic work doesn't usually look like that, and when it comes to hanging, the bones rarely tell us what the screenwriters say they do. The calculated drop. How historical hangings were meant to break the spine. To understand how hangings affect the skeleton, we need to look at how it was once deliberately engineered. In the 19th century, judicial hangings were designed to cause rapid death by breaking the neck. Reforms like Houghton's standard drop in 1866 and Marwood's long drop in 1872 introduced precise fall distances, matched to a person's weight and height. These calculations aim to create enough force to fracture the cervical spine while avoiding decapitation. When the drop was long enough and the knot placed correctly, the neck could hyperextend and dislocate or fracture, often at the second or third vertebral vertebrae. Medical reviews describe this as forceful backward pull on the neck, strong enough to break the spine. Legal and historical accounts confirm that, at the time, breaking the neck was considered the intended and immediate cause of death. Historical engineering analysis of British Home Office execution tables indicate target forces around 1,260 foot-pounds were calculated to reliably fracture the spine. American protocols use similar drop length adjustments. In one documented case, a 5-foot fall in a 220-pound individual caused full separation between the C2 and C3 vertebrae and severed the spinal cord. As I mentioned, these injuries weren't accidental. They required very specific mechanical conditions, deliberately created during judicial executions. And they help explain why the cervical upper fractures are seen in older execution records, but are rarely found in modern cases where short drop or suspension methods, typically resulting in asphyxiation, are more common. In more modern cases, the goal is not to fracture the spine, and often it never was. Unlike the long drop method used in formal executions, short drop and suspension hangings create a very different kind of force. There's no sudden fall, no calculated transfer of energy to the upper neck. Instead, the body is slowly pulled downward by its own weight. Breathing becomes restricted, and over time, oxygen loss leads to unconsciousness and death. This pattern, death by asphyxiation, was not always intentionally designed. In non-judicial settings, the method of suspension often results in suffocation simply because of body position, not because it was planned that way. Unlike judicial hangings, these deaths are not engineered to target the cervical spine. Even before the long drop was developed, many earlier hangings likely caused death through suffocation and not spinal injury. The shift to neck-breaking methods in the 1800s came about as a response to public concerns over the suffering caused by slow strangulation. Reformers and medical officials argued that execution should be quicker and less visibly distressing, leading to the design of systems intended to break the neck swiftly. Which is interesting because gallows were still a public place where people could join together in order to witness executions for entertainment. So when we compare historical execution records to modern forensic cases, the differences in skeletal findings make sense. Judicial long drop hangings were designed to produce high force neck injuries. Modern cases, particularly those involving low drop heights or full body suspension, rarely produce these same skeletal patterns. What we tend to see instead is a lack of bone damage, with the cause of death more closely tied to soft tissue effects and oxygen deprivation. Suffocation. Myths about hanging. As we've already reviewed, many people assume that hanging always breaks the neck, But in modern forensic cases, this is rarely true. Neck fractures are actually uncommon, and in most cases, the bones of the cervical spine actually remain intact. The idea of a snapped neck mostly comes from older execution methods that were used as a calculated drop to generate enough force to break the spine. That kind of force isn't present in most modern hangings. Another common belief is that you can just tell someone was hanged by looking at the skeleton, like our introduction, but bones alone don't usually hold that answer. Hanging affects soft tissues, blood flow to the brain, and oxygen levels, not the skeleton itself. Once the soft tissues have broken down, especially in older remains, there may be no bone changes at all to indicate that a hanging actually occurred. Then some people think the hyoid bone always breaks during hanging, and that if it does, it must mean something violent or suspicious happened. Looking at you, Law and Order. But that's not accurate either. Most hangings don't involve hyoid fractures. When they do, it's usually in older adults because the cartilage surrounding the bone stiffens with age. A fractured hyoid can happen in both hangings and strangulations, so it has to be interpreted carefully in the full context of the case. And as we've touched on, it's also a myth that the body always shows obvious signs of trauma after hanging. In fact, the skin can appear completely unbroken, especially if the ligature was soft or if the body was partially supported. Bruising, marks, or skin impressions may be minimal or even absent, and this doesn't mean the death didn't occur by hanging, it just reflects how the body responds to the specific forces involved. And lastly, it's easy to assume that the position of the body tells us exactly what happened, but that's not always the case, especially after death. As the body decomposes, joints loosen and gravity takes over. A person who is suspended may collapse into sitting or lying position as tissues break down. So when we find skeletal remains, the final position often reflects post-mortem changes, not the original event. What the evidence shows about modern hangings. Forensic data makes it clear skeletal injury is rare in non-judicial hangings. One large study of 766 short drop cases found the cervical spine injury in only about 3.3% of the individuals. And even then, fractures were rare. Most injuries involved ligaments, not bones. Other studies report even lower rates. Across thousands of cases, cervical fractures appear in roughly 1% of modern hangings. A medical imaging study of 100 hanging and near hanging patients found major cervical spine injury in just 2.9% of cases. In contrast, brain injury from lack of oxygen was far more common. So why don't bones usually break? Well, modern hangings, especially short drop or suspension types, don't generate the same kind of force as the long drop executions. Without a rapid fall, the forces on the neck are lower and more evenly distributed. If there is damage, it usually affects the soft tissues, especially the ligaments. However, age can increase the risk slightly. Older individuals may have reduced bone density or weaker connective tissues, but even in those cases, actual fractures still remain uncommon. In most modern cases, the skeleton remains completely intact. This has been the Brit Factor for Bonafide. Thank you for learning with me.